Right, well, it gives me great pleasure to introduce Tim Morris, who is a Principal Research Fellow at UCL and the MRC Trials Unit. Many years ago, he was even younger than he is now. He was at the BSU as a PhD student with Ian White. So that's it. I'll leave you to it.
Thank you, Sean. Can people here online okay? Are we? Sorry, I'll admit these people and move this out of the way. Oh, sorry. Right. Just close that. Sean can do that. Okay. So thank you very much for having me. It's really nice to be here. As Sean mentioned, I used to be here, frequent this building much more often than I do now. So it's been 8 years since I was last here. And I used to be here sometimes once a week or every fortnight for a few years. So it's lovely to be back here. And today I want to talk about an idea that kind of has a history here. Maybe that's why I wanted to talk about it here. But I don't know if you still have this or if it's now a thing of the ancient past, this thing called BSU Together. Okay, Sophia is nodding, David's nodding. You do still have BSU Together. So on the 13th of October 2010, we had a BSU Together, and I think it was the first one I ever came to. And Ian White, who worked here at the time and was my supervisor, was trying to get his head round why he and a colleague had very different approaches to their methodological research, despite being interested in the same topics. So if you said, oh, which topics are you interested in? They would list similar things, and yet their approaches and the things they wanted to focus on were extremely different. So Ian gave this talk. I've got the slides from the talk because it was one of these things that he talked about as a kind of offhand thing. And the idea kept kind of itching me over, well, the next decade at least. And I'm going to sort of give you, well, that was the germ of the idea that I'm discussing today, and that we've just had a paper accepted on. Okay, so the key idea was the idea of a methods development pipeline, right? So the idea that instead of having kind of statistical methodology that is just, you're just doing some sort of statistical methodology, that there is some pipeline that is parallel to other pipelines where you're developing from a sort of new, simple idea to something that really can be used in practice. So think about, I don't know, for example, we were just having a discussion about the sort of food delivery robots, where these little guys like Wall-E type things wander around, deliver food to your house, that I believe Co-op are experimenting with in Cambridge at the moment. So how does that go from someone going, oh yeah, here's an idea, I can kind of build a robot that does that, to something that can genuinely be used in society, that people are happy to use and are widely sort of accepted? I'm going to think about the same kind of idea with statistical methods. So to be clear, I am not proposing that statistical methods should be regulated, but I think it's really interesting to consider how we would approach it if statistical methods were regulated. So if there were people saying you need to get past this step and that step, and really holding you to account for the things you're saying a method can do. Just to give you a bit more context, I'm not talking about when someone doing some applied work just says, oh, how do I do this? And you kind of say, well, I think this is the approach I would take. I'm not quite sure. You kind of have to give someone an answer, which maybe I don't know, or here are some options. I'm thinking about the context where you have a kind of broad program of work on a problem. For example, missing data might be a problem, or on a method, for example, multiple imputation. I always think of those because that's something I've worked on for a long time. But I guess you can think of the same ideas, particularly people here who are at the BSU, where you have these organized themes of work that you're undertaking. Okay, so the work is driven by some general interest in this, either an issue or in a method, rather than by sort of a single study or something someone happened to say that you got a bit interested in. So for people who are funded particularly by the MRC, we have this sort of, well, at least for the last 10 years, MRC have been saying, we want to see the impact of your work. We want to know that someone used it, that it had impact, that there was uptake. And we have this sort of pressure to demonstrate it. For a lot of statisticians, that doesn't come naturally. We're not kind of that showy-offy as a as a profession. And so this kind of thing can be a bit awkward. But I think probably a lot of us do want the work we work on to then be used. And so, although it's difficult to see a slide like, I put this slide up because it makes me cringe, but it's difficult to see that kind of thing where you have to be like, oh yeah, so many people used my work and it's changed the world. Actually, I think if we're honest, we do want the things we do to impact on other people's research and practice. Now, for those of us who are lucky enough to be funded to do statistical methodology, I think some of us will know that it is very hard to get funding for it. And some people will say, well, I don't get to do the things that quite the things I want to do, because it's just hard to get the funding through, for example, the methodology, better methods, better research. And for people who are slightly depressed by the MRC's sort of change of, what's the word, strategy with their units, then this is going to become more of a pressure. So when we see people who successfully get funding for statistical methodology, often it involves promising to do something new, doing all the necessary research for it. I'm going to publish all these papers, producing user-friendly software. It always gets called user-friendly. It's almost a defunct term, isn't it? Then they promise to develop workshops, teach people how to use it. So completely change, go from 0 to 60 with a statistical method within the 3 years or whatever you have of your funding. Now, I sort of think, I've got a video of this, but I think sometimes when we do statistical methodology, I think a view I've seen from statisticians particularly is that, oh, there's this great method and people are just really hesitant to use it. And we kind of view people who might use it like this horse. So you kind of think like, from your perspective, it's like, oh, that's easy. Why do they not just take the step? I'm going to show it again because, you know. So I feel like, I don't know if anyone listening to this talk has that feeling when you think, oh, there's this method and I just want other people to use it and I don't know why they don't. And you kind of viewing them like that horse where it's over hesitant. And I guess, I don't know, I'm linking these two, but perhaps because of the pressure that we have when we have a grant where we've promised to deliver it all, I think some methodologists view researchers doing applied work as being excessively cautious or perhaps unwilling to learn or whatever. So there's this kind of hesitancy that you don't know why it's there. I often hear people do it. Kind of assuming some of you have had this feeling before where you say, well, look, this method is either superior or inferior to other things people are doing, but applied researchers either do not use the superior method or continue to use the inferior method. Now, don't mistake this for saying there's anything wrong with feeling like this. I really do sympathize and frequently feel this way. I'm going to give an example here, which was just a nice kind of caricature of how we kind of sometimes imagine the world works. So there was this paper that appeared in JCE a few months ago now, and it was about correcting. So I've got some points that sort of describe it. So the idea is that these two authors point out that when you estimate sort of unscaled weights in meta-analysis, these are biased upwards. So they say, well, look, we all know they're slightly, or no, they say no one has noticed that these weights that we use are biased. And so they then find an expression for the bias and use it to derive a bias correction. They then try their bias correction out in 2 example meta-analyses. And so these meta-analyses they use have like 2 or 3 studies, and the 2 or 3 studies are small. It's not like, well, certainly the meta-analyses I've seen where there are more than 2 or 3 studies and more than, 5 or 10 people per study. Anyway, what they realize is when they apply their sort of corrected weights to the meta-analysis, it gives a very slightly different result. Now, that's kind of the, well, what I would say is the overview of the paper. And there were a couple of things I thought they'd missed but they basically say, oh, look, this is all obvious. We've just corrected this thing. And so the conclusions they come to are, we recommend that our bias correction should be routinely adopted. And then elimination of this bias will enhance the validity of conclusions from a meta-analysis compared with the situation when the standard weights are used. Okay, so to me, that's really, while I'm saying I understand the frustration when people don't use something that's obviously better, I don't know if that makes you uncomfortable, but I see things like this in papers all the time where people are saying, look, now everyone should change what they do. The upside down smiley perhaps suggests what I think of that. Should we be really routinely changing everything that we do in meta-analysis because of this piece of work? Okay, so why do people not use new methods? I'm very happy now for those of you in the room to shout out some ideas. People online are welcome to as well. We can't hear you, but just shout at your monitor and maybe we can hear them. Can we hear them?
Hello.
Okay. We can hear people online. Would anyone like to suggest reasons why people do not use new methods?
No one else uses that method.
Very good one.
Controversy around, should I use it? Should I not use it?
Okay, yeah. Yep. Any others?
Let's just go with laziness.
Okay.
I'll learn something new.
Yeah, fair point.
Software.
Sorry?
Software availability or easy to use.
Yeah. Yeah.
They are not good at school.
Yeah.
They don't understand it, even though they've tried.
Yeah. Oh man, these are brilliant. I wish this is being recorded, isn't it? I need to write these ones down. I mean, I think you've kind of got all the things that that I think I would think of when you think, why on earth do people not use methods? Think like
More in the chat if you want.
are there? Okay, let's have a quick look at the chat. I'll read out a couple. Yes, not enough time to learn something complex. Our journal audience wouldn't understand. Yeah, viewers don't like it. Absolutely. I mean, these are great. And I think this is really good because what we've got here is a mix of things where some of the objections to using a new method seem to me entirely reasonable, and some of them seem a bit unreasonable. Now, what seems reasonable? To me, it seems really reasonable to say, there is no software that does this. I am not going to program my own estimator because someone's done a simulation study where he thinks, oh yeah, this is really good. Or someone else has derived her results for that thing. And now I've got to be the first one to program it. I think that's really reasonable. lack of time is a funny one, isn't it? Because there is a trade-off between, you know, lazy versus you simply can't be an expert on everything. And I feel this very keenly with things where, you know, I basically get my job description says that I work on statistical methods, and there's it will be probably familiar to you all, but the more stuff that you learn about things and the more you push what you know about one thing, you realize, yeah, I don't know the first thing about that method that someone over there really does understand. And so there is an issue of time that people actually have. Now, Sean, you mentioned people not understanding methods. And again, I don't know, you know, for example, with that paper I just showed up, do people understand why the weights are biased or what this correction does? Has it been communicated in a way that they can go, oh yeah, this does make sense, and I am really reassured by it? If I were someone reading that, would I say, oh, I will change everything I do in all my future meta-analyses? Okay, thank you for that. A really, really nice brainstorm. I'm going to try to save the chat. Now, I think someone mentioned something a bit like this, but where sometimes there is a genuine thing where you think a method is the cat's whiskers and someone else really does not, and you have a genuine disagreement, a fundamental disagreement. I've had this with a couple of people. I imagine some of you have been in this situation where you think, why can't that person just see that it works this way, not that way? And I think it's worth considering two things. That first of all, to them, that is you. And second, that it's, I think, well, just having the humility to realize they may have a point, and that to sort of try not to get too stuck in it and sort of understand why they have misgivings about the thing that you think people should be doing. But I don't think that's super common. I think that it's more often there's the kind of thing where we've got barriers that, you know, someone said, oh yeah, like this thing is really good, but they just didn't give you the key. And this comes back to ideas like software, or what you were originally taught when you were doing an MSc, or having something that explains in simple enough terms the idea that you want people to understand to be able to use it. Okay, so I guess part of what I want to say is that I think, well, when we're frustrated about people not using methods, or using methods that we think are horribly flawed, we need to give them some credit. So let's start at the end. People who are doing applied research, and I assume many people here, I know lots of people here are also doing applied research as well as methods research. People who are doing applied research need to use a method that is going to be suitable for their study. So for example, they are designing a trial, or they have this sort of EHR data set that they're doing some analysis on. Now, let's suppose that these people are motivated to do something as well as they can, and they're not just desperately trying to get something past a journal editor or a regulator, which I guess is just a precedent thing. Where saying, oh, I'll do whatever people have done before, whatever anyone else has got away with, I want to get away with. Let's suppose people are genuinely wanting to sort of do something that is the best thing for my study. I think someone in that position needs to know when a method is and is not going to be the preferred method, what diagnostics you have available, the pitfalls that might happen at application, right? So that's kind of where we want to get to. We want to be able to communicate that understanding to people to get them to use it. So how do we get there? I hope it's helpful for people who are familiar with the phases of drug development, the idea of sort of different phase trials where you have, I mean, this is sort of just not something for you to read all the text, but you know, the idea that you've got these sort of initial studies, that phase 1 trials that really are sort of just a first in human kind of studies or whatever. You've then got things that are phase 2 that may be controlled or may not. And phase 3 that are sort of often the bigger confirmatory kind of comparative studies. And then finally, phase 4, these sort of post-marketing type studies where we're trying to get additional information on a drug's risks and benefits and optimal use. Now, hopefully just by saying that, I'm sort of tickling the idea with you that with statistical methods, we might think in a similar way. So we have just had a paper accepted which sort of proposes the idea of the sort of parallel idea of this for statistical methods. And the background was that, you know, I said that Ian White gave this talk at BSU together 13 years ago now. And we kept talking about it. We kept using this idea of work as being phase 4 or phase 3 or phase 1 or whatever. And then it turned out that Georg Heinze, Anne-Laure Logistic, and Michel Kammer were also talking about the same ideas in parallel. And at some point, Anne-Laure and I talked and realized that we'd had the same ideas. And so we sort of put our ideas together. So I'm going to just quickly talk about the idea of these phases for a statistical method now. So I'll sort of use this table where, for some reason, I've written scope twice. Scope. So I'm going to talk about the scope of work that would be in each phase, the sort of elements it might contain, and then what we would want to know after a phase. The idea is that we want to move on from the germ of an idea, which goes into sort of phase 1, how we move that forward rather than being stuck at phase 1, where we're doing things that are perhaps very interesting, but often technical and not really getting us to that stage we need, that the applied researchers need us to be at. So phase 1 might introduce a new idea, might demonstrate validity or not by investigation of, typically some sort of like asymptotic or maybe finite sample investigation of properties, and give the potential to improve on existing methods or perhaps be the only solution for a particular problem. So often this will be quite mathematical, and there may be some example data analyses where, you know, it might be a specific problem and it's sort of the first idea for dealing with this problem. So after this phase, it would give us some idea about the validity of a method, probably from quite a theoretical point of view. And at this phase or any subsequent phase, we might decide, oh, this method is not worth pursuing. And I think probably there are probably quite a lot of things where you go, oh, I've got this neat idea, and you play around with it and go, no, that's not worth pursuing. And you kind of stop, you don't even write a paper about it, you just stop and go, okay, that was what seemed like a cool idea. Oh, I have used scope in every single slide. Good. Okay, so phase 2 is when ideally we're trying to bring the method forward a little bit, and we want to refine and extend the method. We might want to demonstrate the use of the method with some more real data, and perhaps consider a bit more a limited range of possible applications. By the way, I'm going to give an example in a bit, just to kind of anchor this to something real rather than talking, you know, in the clouds about just an abstract method. So often phase 2 would have simulation studies where it may have some limited comparisons with other methods. Perhaps it's, oh, we know that this method isn't very good in this situation, and here's my new method and how it does fairly well. There may be simple example data analyses. And ideally, after this phase, we would again be reassured whether a method can be used with caution or if it should not be used in certain applied settings. Now, phase 3 is the kind of thing where we're trying to do something a bit broader, and we're trying to say, well, look, how does this new method do against existing methods? And trying to do something that's a bit more, reflects slightly more what you might see in practice. Probably want to consider a wide range of applications where people might be interested in using the method. Simulation studies are going to look at a much wider range of scenarios, and, you know, may have things like lots of different outcome types and different sample sizes, trying to push things to the kind of scope that people would be looking at. And ideally, there would be kind of neutral simulation studies, or with some attempt to be impartial, rather than the ones at phase 2, where I describe them as quite showy offy, where you're kind of trying to demonstrate a method at its best and what problem it solves. Phase 3, you're really trying to say, well, how well is it likely to work in practice? And ideally, we would have some realistic comparative example data analyses, or things that are sort of not set up especially for this method. After this phase, we should hopefully know in which settings a method tends to outperform competing methods. And then phase 4 is, I guess, a slightly funny one, but think about the kind of post-marketing safety issues that you might have in a phase 4, in drug development. Phase 4, you might summarize the evidence about a method, and also in comparison with competing methods. But often you're looking to uncover sort of previously unknown behavior of a method. So some sort of situation where it fails that we did not know it failed. And again, I suppose this is more like edge cases, but considering an extended range of possible or actual applications. You know, someone comes to you and says, oh, I've tried this method that you suggested and it gave me this completely weird result. What happened? And you're kind of trying to unpack the issue that led to what led to this really weird result. That's the kind of thing that I think I describe as phase 4. So I guess in terms of the elements in the middle column, we're thinking about, you know, simulation studies with quite extended and unusual scenarios. Sometimes I call it the kind of thing where you're trying to really stretch and break a method, understand exactly when it fails. So after this phase, ideally, we know when a method is not preferred again, but also things like diagnostics. So the thing where someone's come along to you and said, I've got this weird result. Ideally, you'd be able to say, well, we can work out why that result happens. And that tells us that this is really not the situation to use this method in. I guess, I mean, it's a pithy thing to say, but I guess I kind of feel like it's hard to say you really understand the method until you know when it breaks. And I think it's easy to say, but then when you're actually working on a method, sometimes you think, oh, I just can't work out when it breaks. But I think that's the kind of thing you'd be aiming for in phase 4, is to really, really push a method. Okay. Now, I haven't really talked there about the kind of tutorial papers, and I love a good tutorial paper when I'm trying to understand something that's not an area I know anything about, and someone's written a very clear explanation. Love reading that kind of paper. I don't know if other people have that, but yeah. Now, I haven't really talked about those, and I kind of regard those as outside of the phases and more a sort of synthesis of what we know after a few phases. And sometimes I've read tutorial papers where I go, yeah, that really helps me know how I would use this method in practice. Whereas other times I think, oh, that's kind of summarized some work that's not really got to the stage. Effectively, it's summarized kind of phase 1, 2 kind of work. But arguably, I'd say these papers are not something that we particularly need until we have a bit of a body of later phase work on a method. I wonder at this point, how many of you are thinking of examples? You might be thinking, I see what you're thinking of, but statistical methods development doesn't work like drug development. Yes, you're right. And a single paper may span 2 or more phases, or you may need to do publish several pieces of research that then sort of culminate in having got yourself to the end of, say, phase 1 and 2. I agree, and you're probably able to pick lots of holes in this idea, but I'm going to argue that I found it very useful personally to catch when I'm going through, you know, I guess at the early stage of doing a particular research project, to think, what does this piece of work contribute to? Which phase am I viewing this as? And have I got something really incoherent, like it's got some kind of phase 1-y stuff and some phase 4 type stuff? Does that make sense? And I think it's really useful to at least have thought about this when you're planning what to do, because you kind of need to say, well, it's unrealistic for me to say, look, I will be at the stage of being able to tell people how to use this method when right now I'm just coming up with the idea of the method. Okay, I'm going to go through an example because I think it's nice to have an example to link this to. So this one is one that Georg, the first author of that paper, had worked on. So, and I think it's quite a nice example. So this is about Firth's bias correction for like maximum likelihood estimators. And really, this paper from 1967 in Biometrica was kind of a problem description. And so the problem was described there, and then, as far as I understand, kind of there, sitting there unresolved until the 90s. So in the 90s, Firth's idea, so let's take logistic regression. You can have this idea of separation effectively when log odds ratios go up to plus or minus infinity. So effectively you could say, well, look, in finite samples, logistic regression is infinitely biased. And the idea of Firth's correction is to correct this bias. Well, I won't explain how it works, but basically it's a very neat idea that corrects this bias. And as a neat side effect, you get finite estimates of regression coefficients when you have GLMs and data constellations with no maximum likelihood estimate. So Firth's paper in 1993 was kind of what I would regard as the phase 1. So where he just derived this correction and gave some simple examples. And it was kind of there. He explains how he's derived it, what the motivation is, and that's that. Then in phase 2, well, this is where Georg Heinze worked on it. He did some simulation to demonstrate that the correction did genuinely improve on existing methods, that it wasn't just, oh, look, here's an idea and here's how it works. He was kind of demonstrating something about the idea does seem to work compared to what we have. But that was quite limited, the simulation stuff he did. And then there was really a very comprehensive simulation study led by Martin van Schmeeden, published in 2016, where this was kind of, it was actually a strange one because it was about this kind of 1 variable per 10 events rule that everyone hates. And this was kind of, I guess, a paper kind of tearing that idea apart. But he had this fairly large group of authors, none of whom had worked on any of the methods they were, or who had developed any of the methods they were considering. They designed this simulation study, and Firth's correction came out and had this really nice performance across mostly across the board. So that was kind of a phase 3. It was a large kind of comprehensive group of people together. And then what arguably is a phase 4 paper is one by Mohammed Ali Mansonia and colleagues in AJE. And they kind of, this paper is one of those ones that explains why different methods lead to different results. And it gives advice on how to detect and deal with separation in practice. So very much practical about like, in this specific situation, this is where Firth's correction is likely to help you. Whereas in this situation, you don't need to worry. So that's an example of kind of what the 4 phases might look like. You may be wondering, like, what is all the point of this, Tim? I think it's really hard for applied researchers to keep up with methodological developments. As someone who started out doing applied work and was trying to keep up with methodological developments, it's so hard to, like, there's just so much, and you don't just have 1 problem or 2 problems with a given study that you're involved in. It's got several typically. So you have to try and work out what you can learn in the short time available to you to do as good a job on this study as you can. So I think it's also pretty reasonable for them to be cautious about using a new method. So for example, if a drug had been through phase 1 and 2 trials, would you go saying to your friends or family members, oh yeah, you should take this? Or would you say wider society as a whole? Like the whole point of that regulation is to say when you can stop being so cautious and when you should start saying, oh yeah, this is a useful treatment or intervention. Now, Georg did this when we were talking about these phases. We did a very informal review of 4 journals that we just thought up, statistical journals. So on the top left, we have statistical methods in medical research. Top right is biometrica. Bottom left, stats in medicine, and bottom right, biometrical journal. So it's just 4 journals we picked. Now, what I would have guessed is that biometrica would be very much phase 1, and things like, well, probably statistics in medicine and biometrical journal maybe would be later phase. What may be quite stark to you here is there is very little classified as phase 3 or phase 4. In case it's not clear, this is kind of each journal copy represents 1 article that we reviewed. Sorry, I should have said that. And so this is basically the number that we would have classified as belonging to that phase. So it's sort of a silly example, but it's quite nice to see, I think, that there is very much a focus on, well, particularly phase 2 and perhaps a bit phase 1. Now, is that a good thing? I think possibly or possibly not. It may be that there are lots of nice ideas that we take to phase 2 and then say, not such a nice idea, and stop. And that's fine. Or it may be that we get to phase 2 and say, this is a great idea, everyone should use this method. And then actually we never go and do the next pieces of work that are going to enable use of that method. Okay, so back to what is the point of all this? I hope that if you are someone who is frustrated and thinking, why on earth are people not using this method? Then I hope it gives you a framework to understand why a method is not universally adopted. I hope that it helps to give a bit more weight to the late phase research, which, you know, funders don't go, oh yeah, I want to fund a large sort of impartial collaboration to do a simulation study of a load of existing methods. They don't want that. They want sort of novel innovation, new ideas. And so I think we need to somehow give a bit more weight to the late phase stuff. I also think it's important to understand applied researchers' hesitation about using new methods, or perhaps it's not hesitation, perhaps it's just, I have a million things coming at me and no one has given me that paper that says, this is when I should use this method and this is how. This should have been animated. Anyway, if you are frustrated, then there is some encouragement from the bibliometrics literature. There is this idea, apparently, I know one person who works in this world of bibliometrics, and she says, oh yeah, well, there's this idea, everyone knows about it, this idea of sleeping beauties, where you have a paper or a couple of papers that are there and are published and languish and nothing happens. And then 2 or 3 decades later, someone spots it and goes, that's a really nice idea. We should kind of, tell people about it. We should investigate it further. And, we've got a couple of things that it should have animated. But for example, if you look at sort of citations to like the Cox model or to the original paper on propensity scores, there was a good 10, 12-year lag where nothing. And then at some point, and I think it was the point when people wrote software that actually implemented these things properly, there's this sudden sort of takeoff where these things are being cited and used. Oh yeah, there, now we've got it. And to an extent, multiple imputation also, I think it was first proposed in 78. And then really not very used until the mid to late 90s, when people started to take it out of the phase 1 setting it had been in for 2 decades and really bring it into being usable in practice. Okay, I've sort of already said this. So I think really that's all I've got to say. I've got a few points here for discussion if you want it, but I'm very happy to take questions, and thank you very much for your attention.
So we'll take questions in the room if there are any, first of all, and then if anybody wants to ask a question online, then please just say in the chat that you'd like to do that, and I'll invite you to unmute yourself at the appropriate time.
Simon.
If you want to really stretch your metaphor,
Yeah.
what are methods that are equivalent to failed drugs then?
Ooh. Do you mean ones where people have started to use them and then gone, we actually should not be using this? I was thinking of one the other day and my mind has gone completely blank. I'll come back to you if it jumps back into my head. Good question. Any ideas from people? Gonna check the chat. 3+3 design. Propensity score matching, yeah. Where these methods have that, yeah. Last observation carried forward. I don't think anyone ever said they should do that, did they? People just started doing it.
Randomized play the winner.
Randomized play the winner. Yeah. I mean, there are lots of methods people do use that I think then we go, we shouldn't use that. I suppose the question is, were those methods ever put through their paces in the first place and then stopped? Or did people just start using them and then realize we shouldn't have done that? And I think, Simon, you're looking for things that people did develop sense.
I'm just trying to play with your metaphor. Drugs feel at any phase.
Yeah, right. Exactly. David.
So you talk quite a bit about software. So I wondered how that fits in with these phases. Could it be any phase software is developed or stuff?
Good question.
Separate to these things.
I think there very much is sort of early phase and late phase software, isn't there? You know, some software you've got things where you try it and it gives you a result and that's that. And some software will tell you things and it will return things to you and it'll say, oh, warnings and that kind of thing. So warnings about issues with your data, that kind of thing happens at much later phase software and better developed. And I'm sure you've played with software before where it's done something and given you a result and then you've gone, oh, that's nonsense. Or it's given you something completely different to when you try it by hand. And, you know, people always just say, oh, user-friendly software. Like, yes, that is useful, but no one tries to make their software user-unfriendly. What you want is something that's actually giving you diagnostics and pitfalls and will give you warnings when there are problems. I don't know. Do you have any thoughts?
I mean, I guess you could have phases of software development, like you were saying, or I wondered if they also are part of these phases of methodological research, or should it be for somewhat separate?
Sorry, I missed the last bit you said.
Oh, as in, should software be thought of somewhat separately? Like in a way, tutorial papers are kind of outside this software, and then outside this.
I guess so, but I suppose if you want, so suppose you're the person who sort of owns thinks of the method as yours, and you do the sort of phase 1 and 2 work, then at that stage you probably need to make, you probably need the parallel software development, don't you? So that then other people can go and put it through its paces in their big simulation study where, you know, some people are a bit skeptical and others are enthusiastic. Yeah, I don't know. I guess it needs to be parallel to some extent, because ultimately if there's no software, no one uses the method. But
Okay.
Yeah.
Thank you for a great talk. That was really interesting. I was wondering, when you reviewed the papers and you said there's no phase 4, you said probably we're not doing it, but did you look at other journals? Are we publishing phase 4 for some methods in, I don't know, already community spaces, like, I don't know, PNC medicine? I don't know. I would.
Yeah, that's true.
But I don't think that that's completely the answer. I think a lot of there's not enough phase 4, but possibly it's worth thinking, where should we publish phase 4?
Yeah, that's a good point. I mean, the phase 4 example I gave was an AJE paper, and we were just looking at a narrow range of stats journals. I think you're right. There probably is more than I'm saying here, or than that shows.
But I agree that we still need more phase 4, but probably there is some that it's not reflected in there because of the journal.
Yeah. Phase 4 is a funny one, isn't it? Because I feel like that, I don't know how many people have this, but journals really, really want phase 4 stuff, but it's very hard to have time. It takes a long time to get the kind of understanding of pitfalls and diagnostics and the broad understanding of this method and its competitors and all the situations it's used in to be able to write something like that. So it's like this huge sort of reservoir of knowledge that you need to be able to write one. And I guess that sort of explains, whereas with a phase 2, you can come to an area, do a limited simulation study, and that's it. Martin.
Are statisticians I've lost it. Are statisticians addicted to early phase work? Is it easier to start with a blank piece of paper than pick up something that's already been done a little bit messy, that someone else has done in a way that you wouldn't quite do and would find it difficult to grapple with, or something that's just novel rather than something that's not novel?
Good question. I don't know if you have this, but early phase stuff is the stuff I'm more likely to get excited about.
Exactly, yeah.
And the late phase stuff is like, oh yeah, that's important and useful, but it's not as exciting. It's just, you don't go, oh yeah, that could be really fun. And yeah, early phase stuff is often like that, isn't it?
Yeah, you play with that and you can tinker with things, and you have it's an open door.
Yeah. Yeah, definitely.
I'm thinking about phase 4 setup, where people would perform review of methods, and in the meanwhile, the literature is growing. I wonder, Tim, if you have any opinion, like when would be a good time to review a collection of methods? Is it something we can choose? Just on the point when you feel you would like to do that?
Good question. I don't know that there's a good answer to that. If I think about my systematic review colleagues, and they're doing systematic reviews of interventions in trials, and they've got this whole framework for timing of a systematic review when you know results from trials are coming in, because it's to address this kind of problem. They call it fame, and having, the problem is we don't have any kind of intelligence like that in statistical methods, that, oh, we know there's this person ongoing with their phase 3 and that person, and we expect the last results to come in and the paper will be published. Like, we've just got to deal with what we know at the time. And I think it's fair to say you can do phase 4 when you do it, and new information may come out, and it may come out subsequently, and you think, oh, I wish I'd known that. I don't know we can do anything other than be pragmatic there.
Go on, Simon. So we talked about publishing. Is phase 4, in another view, someone writing a textbook on it?
Possibly, yeah.
I mean, I'm just thinking of things like I mean, one of the ones we all cite, like the elements of statistical learning.
Yeah,
Which is like the book, which put everything in one place.
yeah,
I mean, there are other ones, but like that's the one that immediately pops into my mind.
yeah,
If you want, here's the field as it was like a decade ago.
yeah,
So
yeah.
where
I
do
think-
books and textbooks fit into this? Are they essentially phase 4?
I don't think they are phase 4, but I think that is a really nice example of a phase 4, where it is very much the culmination of knowledge. And that one in particular represents a kind of like milestone of where things have got to at that point, which is a solid foundation where you can think, oh, then stuff did happen afterwards, but it's a really good summary. You get other books that are, so going to the multiple imputation example, Rubin's 1987 book is viewed as seminal, but I would say that's phase 1. He's really setting up some of the theory and doesn't get to the point of, doesn't get any further. So I think textbooks are the same, but they're a really good opportunity to do phase 4. Yeah. I don't know, but I'm now wondering, are there texts that sort of sit in between? Because often they're very early phase or very late phase, and I kind of get the middle. But
Name names.
Okay, so we have a question from, we've lost a question. We have a question from Werner Vach.
Yes, I have put a question on the chat, and it's basically, I think it's a great talk and wonderful ideas, but my impression is that this describes a situation which were relevant perhaps 30 years ago, but today I think the scientific community is adopting methods after completely different criteria, and they don't care about what statisticians say about methods. They are just adopting methods which give nice results, which fit to their interests and their expectations. So I have a little bit impression that what you describe is a very academic approach, and we have to ask ourselves whether it's still today the way to go. And there were other comments here also saying everything is available in R. A PhD student can make something public, and the next day all people are using it, and that happens. So is it still, or how relevant is all these ideas about phases in statistical methods if it's too late to do this?
yeah, fair point. I think it's, I suspect it depends on the area that you're working in. So where I work, it's a lot of the time it's in trials where people are very cautious because, well, partly just because trials are trials, but partly because of possibly dealing with regulators and needing to be able to justify what you've done. And so, well, certainly people who work at some companies will say, look, I'm not willing to use a method that has never gone past regulators because I don't know how they'll view it. And so they've got almost the opposite problem where they will not use new methods. Certainly, I know there are areas where, as you say, people will just use whatever gives them the answer they want. I think it's a challenge to us, though, if you find, I mean, that it may be that people are beyond hope, you know, that some people are just, we cannot persuade them to use good methods at all. In that case, fair enough. We need to think about people who could be persuadable and who are actually interested in using things that work in a good, well, you know, that are fit for purpose. What you're describing is people who don't care if a method's fit for use. And I think there's still a huge number of people who really do care about doing things right, but just don't quite know what is the right thing to do.
I think the problem is that most of the people adapting is they also think they are doing it adequately and correctly. And it's often that they just do what their colleagues are doing. They have seen something and they adopt it. And that's the way how methods are spreading today. And I think we have to find a way how we deal with this. We cannot just say we are working for those who are interested in good methods. And we have we have to think about who are the multiplicators. And it's not statisticians who are today multiplicators. That's my impression.
I guess maybe we need to get better at marketing what we do.
Yes.
So we have a question from Konstantin Schmidt. If you'd like to unmute yourself, Konstantin. Or I can read out your question if, yeah, maybe I have to. It seems like maybe I have to unmute you. I'm not sure whether I have to. Finding you is going to be a.
Shall I read out the question?
Yeah,
So for people in the room mainly, I guess. So Konstantin says, when I was trying to use the latest methods for applied work, I struggled with this. Methods papers use examples or simulations that make their methods shine. However, real data does not match these scenarios, and the applied researcher with no guidance as to which method is superior in general. Do you think the use of simulation studies specifically tailored to the methods is good practice in the first place? Yeah, that's a challenging question. To be honest, I think sometimes what we do is, well, this is probably kind of phase 2 simulations, right? Where people are doing stuff that really is showing the method shine. I think it's fair to do that when it's motivated by a real problem and you're kind of showing what problem your method aims to address. But I really don't think, so I don't think it's sort of unethical to do that kind of simulation study. I do think that we are much too quick to take the leap to say, so people should use this method. You know, if we have designed a simulation study that shows this method in the best light, we should not be telling people to always use it. And it's difficult. I mean, I think probably to try and be generous, people don't know they're doing that. They're just thinking, look, I've got this problem. This method seems to solve it. So there it is for everyone. I don't think it's trying to cheat people and make them use their method. Simon.
Do you think we should do RCTs of methods then? Blinded. Give people blinded data sets. So they don't know the truth.
People have done that, haven't they?
In some challenges.
They have that causal inference challenge and there's a prediction challenge and yeah. I don't know. I don't know what you think of them. I never find them that persuasive. They're fun, but yeah.
So I think we have a few more questions. But can you keep the questions and the answers fairly brief? So we've got Mark Pilling. Mark, can you unmute yourself, or if not, then we read out the question. There's a comment actually, rather than a question. So maybe we'll leave that one. So Stephen Kaptogi, would you like to ask your question?
It's more of a comment. It's just a question about methods struggling with very large data sets, even methods implemented in mainstream software. What do you think about that?
Sorry, what?
Once you have a data set which has got, say, 1 million or 2 million observations, even mainstream methods start to struggle to optimize in very large scale data. So the question is, how do methodologists come into solving such problems, especially with EHR data now being common?
Yeah. So is I guess the main limiting thing there is really the computer being able to handle using a method on the data, isn't it? Rather than does the method work? It's can I actually do this, right? I mean,
sure. Or partitioning the problem into manageable ways to combine it a bit.
Yeah. I don't know I've got anything useful to say about that. I think it's I think it's a thing that's, well, there's a really important thing to do, but also very hard to know how we address it. Yeah, you can't imagine people doing simulation studies on data sets of that size that are that realistic. You know, there are people trying with this kind of thing, but I imagine it doesn't quite get there most of the time.
Okay, one final question from Stephen Burgess, who asks, do you think we'll run out of statistical ideas soon and spend more time doing phase 3 or 4 work?
I don't know. have you started running out of ideas, Steve? I certainly find that come and come.
So I guess what I was wondering is, do you think there is an evolution that, you know, as R becomes more prevalent, as software becomes more prevalent, that actually we will spend less time, and actually that this is a good thing, that we will, I don't know, kind of settle towards, that there's some kind of random walk process going on whereby statistical methods are improving over time, and actually we should spend more of our time doing the phase 3, 4 work rather than the coming up with initial ideas work.
I really like that idea, and I like to think that that will happen. I suspect all of our incentives are not for that really, but but
How
I
can
guess
we
if
change
people
those
start running out-
incentives then?
Yeah, that's a good question. Have you managed to convince funders to fund phase 3 or 4 work?
Yeah, I mean, there are emerging journals. I mean, we've got some work at Wellcome Open Research, for example, which we see as an ongoing project, that every kind of 18, 24 months we'd go back and we'd revise guidelines. So I think there are infrastructure kind of building to do that sort of project. And I think we can build case studies around it sometimes, around, you know, not just, you know, this is the story, this is the paper, and there our interest in that problem ends. One thing which I particularly like about how you frame this problem is how you frame it as the statistician's responsibility. Like, it's very easy for us to kind of point fingers and say, why aren't people using our methods? But actually, we should really see that as our responsibility to make our methods understandable and tested and rigorous enough that people would want to use them.
Yeah, that's really good to hear about the welcome thing. Would you mind sending me a link to it after this, Steve?
Sure, no worries.
Thank you.
Okay, thank you very much indeed, Tim. Thank you for all your questions as well. And that's it. Thank you. Bye-bye.